I've learned something over the years as a doctor. Patients rarely come to me with just the medical problem they mention first. Behind almost every symptom is a story, and sometimes a secret they've never told anyone else. This is one of those days.
It started like any other consultation. A woman walked into my clinic complaining of a persistent headache. Straightforward, common, nothing unusual. I did everything by the book. Took her history, asked all necessary questions, performed a physical exam, ran tests to rule out the concerning causes. Everything came back normal. I prescribed something to ease the pain, reassured her, and told her she could always return if things didn't improve. I expected her to say thank you and leave, but she didn't. Instead, she lingered. Her bag was still open. Her hand stayed on the chair. She looked at the door, then back at me. Something wasn't right. I gently asked if there was anything else. She shook her head. I reminded her that other patients were waiting. That's when her voice broke a little. "Doctor, please, I need to tell you all my problems." So I sat back down. She took a deep breath. Her headache wasn't the real issue at all. She told me about her husband, how he regularly stole money from her purse, how he refused to touch her at home, how he sometimes wouldn't come back home at all, disappearing for days, how she felt like a stranger in her own marriage. She hadn't told her family. She hadn't told her friends. But she told me. In that moment, she wasn't a patient with a headache. She was a woman carrying emotional wounds that were far deeper and more painful than anything a scan could reveal. The headache was the symptom, but the real illness was the heaviness she'd been living with alone. People often think doctors just diagnose and prescribe. But the truth? We become silent witnesses to some of the most personal parts of people's lives. Medicine doesn't teach us how to handle someone's breaking heart, or a crumbling marriage, or decades of emotional neglect. Yet these are the moments that stay with us. Before she left that day, I wasn't just treating her headache. I was helping her release pain she'd held in for far too long. And it reminded me of something important. Sometimes, the symptoms people complain about aren't in the body. They're in the life they're living. And a doctor, often, is the first safe person they choose to open up to. If you found this story meaningful, let me know. I have many more encounters that reveal the hidden truths behind doctor-patient conversations.